Burnout versus depression, understanding the differences. Hi, I'm Gabrielle Juliano-Villani. I'm a licensed clinical social worker and I specialize in burnout and chronic stress. In this video, we will go over burnout and depression and talk about the differences. While the features of burnout may mirror the symptoms of depression, burnout is not a diagnosable clinical condition like depression is. Burnout is more a state of being in an extreme exhaustion and unresolved chronic stress. If burnout persists, it's definitely a risk factor for leading to depression. Possible that those feelings of exhaustion can lead into full-blown clinical depression with more severe symptoms. With burnout, you may notice you have a negative attitude towards clients, consumers, and colleagues. When people don't feel accomplished, their productivity is impacted, and this can perpetuate a cycle of workplace dissatisfaction or even more stress. Common signs and symptoms of burnout include irritability, poor work performance, cynicism, sleep issues, feeling unaccomplished, having escape fantasies, generally feeling unwell, and identity issues. Anyone can experience burnout at any point in their lives, but people with high stress or emotion-focused jobs are at a higher risk of burning out. Additional risk factors for burnout may include micromanagement, unclear boundaries at work, working too much, feeling like you're being judged or scrutinized by your superiors, difficulty managing your interpersonal relationships at work, secondary trauma, frustration with the system or red tape, feeling like you lost track of your own goals, and being pushed in several different directions at once. Depression involves a low mood and feelings of hopelessness and chronic sadness. These issues come with a feeling of tiredness and a more negative outlook. Depression can also include thoughts of self-harm or actual self-harm. Depression can also come after the high of an anxiety attack. Though depression is marked by an overall low sense of feeling, even during times of anxiety. Common signs of depression include guilt, low energy, feelings of hopelessness, feeling empty, restlessness, irritability, low feelings of self-worth, and general thoughts about death or dying or even suicidal ideation. Anybody can be at risk for depression, but some individuals are at a greater risk of others. Those who have negative childhood experiences or childhood trauma, family history of depression, or unresolved grief may be at higher risk dealing with depression. Risk factors for depression may include family history and genetics, your own mental health history, unresolved grief or feelings around a recent loss, increases or change in substance use, a breakup or divorce, a big move or a change in job, or other big life transitions. While there are some overlapping symptoms of depression and burnout, such as loss of interest, low mood, and difficulty concentrating, there are also major differences. To meet criteria for depression, somebody must be exhibiting a combination of symptoms for a period of at least 2 weeks, whereas with burnout, there is no specific timeline or diagnosis criteria. Here are the key differences between burnout and depression. How long the symptoms usually last. There's no definite timeline for the symptoms of burnout, although you can expect for symptoms to be present for at least a few weeks to even a few months for it to be considered burnout. But for depressive episodes, they must last at least 2 weeks. There are also all kinds of different symptoms and even different types of depression. Causes. So prolonged or chronic stress can definitely play a role in depression, but if you remove that stressor, it doesn't necessarily cure depression. Depression can be circumstantial, or it can even be genetic or passed down through families. And also, burnout is more complex than just stress. Burnout can affect someone's sense of purpose and even their self-worth. Treatment options. Burnout is best managed through talking with others, making time to relax, and addressing the conflict within you. Because of the heavy impact that depression can have on someone's life, usually the best form of treatment is either medication, psychotherapy, or a mixture of both. Unexamined burnout may certainly lead to depression if left unresolved. Burnout is an emotionally and physically exhaustive state that can totally lead to a depressive episode if not treated early on. Burnout also has a lot of similar symptoms to depression that overlap, like fatigue and just generally not feeling great. And burnout and depression do have a relationship together. They can be linked by the experience of stress due to the lack of control over your environment. While burnout and depression may have overlapping symptoms, they are separate conditions with major differences. Depression is a diagnosable disorder, whereas burnout is more of a state or a condition that is typically more resolvable and preventable. However, with both of these things, it's really important that you reach out, get support sooner rather than later. We want to make sure we can try and resolve the symptoms and the conflicts before they worsen into something much bigger.